Okay, Andrew, every supplement aisle now has CoQ10 labeled like a mitochondrial booster for everyday fatigue. Is that what the evidence actually supports? Or is the marketing just borrowing a real cell biology story and stretching it into an energy promise people feel they should buy?
Start with where CoQ10 actually lives. Your body makes it, and levels are highest in energy-hungry organs, the heart, liver, kidneys, and pancreas. Researchers got interested because some disease states show lower CoQ10. That is interesting biology and a fair research prompt. But it is not automatic proof that supplementing restores youth, stamina, or daytime energy for everyone. Mechanistically, CoQ10 sits in the mitochondrial electron transport chain and also participates in antioxidant systems in membranes. That dual job is why people call it a mitochondrial nutrient. The leap that fails is treating every tired afternoon as a CoQ10 deficiency that a soft gel will reverse without a clearer clinical target.
If I ignore influencer charts for a minute, what does a cautious medical summary actually say CoQ10 helps? And where do the results stay inconclusive enough that the aisle should quiet down?
NCCIH is blunt. CoQ10 has not been shown valuable for treating cancer, though it may reduce heart damage risk from one chemotherapy drug. Only a few studies looked at preventing heart disease, and those results are inconclusive. Heart failure research is also inconclusive. There is evidence it may reduce some complications of heart surgery. Keep that hierarchy in your head when a bottle promises whole heart protection.
Then why do sports nutrition videos sound so confident about performance chemistry? If someone is hammering repeated hard sessions, does CoQ10 actually move oxidative stress or muscle damage markers? Or is that still mostly hype dressed as mitochondria?
In under 19 soccer players doing 3 90-minute match simulations, 14 days of CoQ10 at 300 milligrams beat placebo on oxidative stress and muscle damage markers. Malonaldehyde and LDH fell more, cortisol stayed lower, and the testosterone to cortisol ratio held up better. Taurine looked stronger for raising IL-10. Immune counts looked better with either supplement than placebo. No adverse events were reported, but it remains a small preliminary sports trial.
Aging is the other big sales pitch I keep seeing. If someone is chasing a biological age number rather than match recovery, did CoQ10 actually move a hard aging-related marker in longer trials, or are we still guessing?
A 2-year randomized pilot used an NT-proBNP-derived biological age surrogate called proBNP. The CoQ10 plus selenium arm did not show significant primary or secondary differences versus placebo after dropouts and imperfect intake. In the combined underpowered groups, proBNP still rose over 2 years, especially after age 70. The study mainly refined how to power future anti-aging trials. It did not crown CoQ10 as age reversal. Metabolic reviews are similarly careful. An umbrella of meta-analyses suggests CoQ10 can lower fasting glucose, but HbA1c, HOMA-IR, and insulin effects change with the analytic approach. Weighted mean pooling looked more favorable than standardized mean pooling. Translate that as a moderate, method-sensitive glycemic signal in diabetes research, not a license to swap prescribed glucose medicine for soft gels because mitochondria sound persuasive.
Shoppers also fight over ubiquinol versus ubiquinone in every comment section. If absorption differs that much, should product form change the buying decision before anyone even starts bragging about milligrams on the label?
A small randomized double-blind crossover in 12 fasting healthy adults compared a novel ubiquinol co-crystal soft gel with a ubiquinone reference. Relative bioavailability favored ubiquinol, with geometric mean ratios about 2 for peak concentration and AUC to the last measurable time, and higher still for AUC to infinity. No adverse events were reported in that pilot. Formulation is part of the evidence, not a footnote under the milligram number. People also confuse ordinary CoQ10 with MitoQ, a mitochondria-targeted quinone used in vascular research. An 8-week randomized placebo-controlled crossover in 30 middle-aged adults using 20 milligrams daily found no meaningful change in estimated filtration rate or urinary kidney injury markers. No kidney benefit, and also no kidney harm signal in that window. Targeted delivery still needs outcome-specific proof before anyone treats it like a universal mitochondrial upgrade.
Statin users are the loudest CoQ10 audience I meet. Statins can lower CoQ10, but does that mean a supplement reliably fixes statin muscle symptoms? Or is that a leap people should not self-manage from a video thumbnail?
Outside the usual hard aisle story, a juvenile idiopathic arthritis pilot randomized active patients to CoQ10 100 milligrams daily or placebo plus standard therapy for 3 months. Disease activity fell more with CoQ10, quality of life scores improved, and TNF-alpha plus oxidative markers moved favorably, with mostly minor side effects. That is promising adjunctive pediatric rheumatology data and not a do-it-yourself autoimmune protocol for adults.
Before anyone treats CoQ10 like a harmless vitamin gummy, which medication contexts actually force a clinician conversation warfarin, blood pressure drugs, chemotherapy calendars, or basically all of those together?
If someone still wants a practical test, name the target before buying. Match recovery markers, a clinician-supervised cardiometabolic question, or a documented drug interaction review are clearer than vague vitality. Compound products that mix fish oil, resveratrol, astaxanthin, and CoQ10 can move selected vessel measures without proving CoQ10 alone did the work. Set a review date, and change expectations if the named marker never moves.
One last boundary people blur online. If CoQ10 might help selected chemotherapy heart stress, does that mean stacking antioxidants during active oxidative chemo is smart, or should that decision stay with oncology?
That decision stays with oncology. NCCIH notes a possible CoQ10 role against heart damage from one chemotherapy drug, but breast cancer antioxidant reviews warn that broad antioxidant stacking during active oxidative chemo can work against treatment biology. And the everyday rule still stands. Do not stop a statin or heart medicine for a mitochondrial claim. Supplements are not drugs, quality varies, and GI upset is the usual nuisance.